Hi, today I'm going to help show you how to prepare for and take your NUCALA injection. First, your doctor should teach you how to use the autoinjector. You should also read the full instructions for use in your NUCALA carton or at NUCALA.com. I'll walk you through the injection like your doctor may have. If you have questions or concerns, you can always talk to your doctor about NUCALA. And remember, you got this. It shouldn't take long for you to get more comfortable with injecting medicine yourself. Let's get started. First, take the carton out of the refrigerator. Check to make sure the security seals aren't broken. If a seal is broken, don't use the autoinjector and safely throw the carton away. Now, take the tray out of the carton. Peel off the clear plastic cover, and while holding the middle of the autoinjector, carefully take it out. Before we begin, let's look at the components of the autoinjector. Don't remove the clear needle cap at this step. Check the expiration date on the label of your autoinjector and make sure it hasn't passed. Look at the medicine in the inspection window. It's normal to see one or more air bubbles. It should be clear to pale yellow to pale brown in color. If it's cloudy, discolored, or has particles floating in it, don't use it. Now put the autoinjector down on a clean, flat surface at room temperature, away from direct sunlight and out of the reach of children. Don't try to warm it up any other way. You'll need to wait 30 minutes before use. Don't use it if it's left out of the carton more than 8 hours. You can take this time to gather the supplies you need: an alcohol swab, a cotton ball or gauze, an adhesive bandage, and a sharps disposal container. The autoinjector is only for use under the skin. Now you can choose your injection site. You can inject yourself in your thigh or abdomen. Or if you're a caregiver or healthcare provider giving the injection to someone else, you can also choose to inject in the upper arm. If you need more than one injection to complete your dose, leave at least 2 inches between each injection site. Now, wash your hands well with soap and water. Clean the area you want to inject by wiping your skin with an alcohol swab and allowing it to air dry. Now remove the clear needle cap from the autoinjector by pulling it straight off. This could take a little force. You may see a drop of medicine at the end of the needle, and that's normal. Always inject within 5 minutes after you remove the clear needle cap. Do not touch the yellow needle guard with your fingers, and don't put the needle cap back onto the autoinjector, because that could accidentally start the injection. Touching the yellow needle guard may also cause a needle injury. Hold the autoinjector so you can see its inspection window. Place the autoinjector straight onto your injection site with the yellow needle guard flat on the surface of your skin. To start your injection, push the whole autoinjector all the way down and keep it held down against your skin. This will make the yellow needle guard slide up into the autoinjector. If the yellow needle guard does not slide up, don't use the autoinjector. Throw it away in a sharps disposal container. You should hear a click to let you know your injection has started. The yellow indicator will move down through the inspection window as you receive your dose. Don't change the position of the autoinjector and hold it in place. Your injection may take up to 15 seconds to complete. Continue to hold until you hear the second click. The stopper has stopped moving and the inspection window is filled with the yellow indicator. If you don't hear the second click, check that the inspection window is filled with the yellow indicator, or hold the autoinjector down for 15 seconds to make sure the injection is complete. After you hear the second click, continue to hold and count to 5. Then gently lift the autoinjector away from your skin. Do not put the needle cap back on. Don't rub your injection site. You may see a small drop of blood, which is normal. Just press a cotton ball or gauze on the area and apply an adhesive bandage if you need it. To clean up, put your used autoinjector in a sharps disposal container right away, and keep the container out of the reach of children. That's it for the injection. Once you do a few of these, it should become just another part of your treatment routine. If you have any questions or need more information, talk to your doctor. You can also call the nurse support line at 844-4-NUCALA to get help with your injections or any general questions you have about NUCALA. For additional resources and support, you can turn to My NUCALA. Look for it on NUCALA.com.